Good afternoon. Good afternoon, everybody. I hope everybody had a nice weekend and looking forward to the holiday next weekend. I want to thank you all for continuing to tune in at 1 o'clock. I will be here again on Wednesday this week at 1 o'clock, and I would encourage you to tune in if you can, if not to watch it later. If you can't find time to watch it, please sign up for the daily email updates. You can do that by going to the governor's website, governor.ri.gov, and sign up for the daily email updates. This virus is still with us. You can see from the experiences all around the country that it's an ever-changing situation, and that means you have to stay informed. Today I'm going to roll out some new rules and guidelines, be rolling out more on Wednesday, could be changes next week. We just don't know. We don't know. We have to stay flexible, and that means I'm asking each and every one of you to stay informed. Easiest way is to tune in at 1 o'clock. If you can't do that, please sign up for the emails. We want to get you the best information that we can so you can keep yourselves and your family and your employees safe. We'll begin today, as we always do. I'd ask you to please put the data up on the screen. As you can see from the data on the screen, Rhode Island is continuing to trend in the right direction. Such a relief. It's hard to read the paper these days and see the headlines all around the country, but the data in front of you show you a picture of Rhode Island, which is continuing to trend in the right direction. And of course, we watch this every day throughout the weekend. Today, we have another 16 cases to report, and very sadly, another 6 deaths. And Dr. Alexander Scott will go through that. I will say, as I've often said here, thank you to the people of Rhode Island. There was a report out yesterday showing that there are only 2 states in America, only 2 states in the country, that are continuing to see declines in cases as of last week. And Rhode Island is one of those states, Rhode Island and Connecticut. So we are setting an example for the rest of America to follow, and I want to stay there. I want us to continue to lead the nation. I don't want setbacks. And the reality is we are where we are because the people of Rhode Island have been following the rules. Wearing their masks, staying home when they're sick, getting tested, keeping 6 feet apart. And I promise you this, if you stop following the rules, we'll have to shut down the economy again because we're gonna be like many of these other states going right back up the curve. It's inevitable, it's a fact, it's science, we can't fight it. I wish we could, but we can't. So I think you should take pride in the fact that Rhode Island is one of only 2 states in the country that saw a decline in cases last week. Pat yourself on the back. All of the inconvenience that you've endured by following the rules is absolutely paying off, and I'm asking you to stick with it. Because for all of the opinions of what we should and shouldn't do, the facts are in, our approach is working, and we need to stick with it. I will say that the story across the country is a very different story than the story we're seeing here in Rhode Island. And I'd ask you to please put up the next slide. Don't take my word for it, but look at the data on the slide before you. New cases of coronavirus in the United States reached a new high on June 26 last week of almost 45,000 cases. This is the highest that they've ever been. Now, as I said, in Rhode Island, we have a sense of shared responsibility to one another and a sense of individual responsibility. So we're wearing our masks, staying 6 feet apart, and following the rules. But if you look at the data in front of you, that is absolutely not the case in much of the rest of America. I want you to say to yourself, what do I have to do to be part of prevention? You don't want to be part of an outbreak. You don't want to be the person who's not following the rules, hanging out in big crowds, going out or going to work if you're sick, and being a part of an outbreak. It should be a badge of honor, of Rhode Island pride, to follow the rules, to keep your neighbors and your friends and your family and your coworkers safe. And we don't want to have the setbacks of some states around the country. And I know today everyone wants to know, of course, the news is, are you going to move us to phase 3? And the answer is yes, and I'm going to go through that in a second. I'm going to explain why and how I've made this decision, and also what it's going to look like in phase 3. But before I do that, I just would like you to hear me out on the specific experiences of a few other places. Texas, Florida, and Los Angeles they all reopened, but now they are closing again. Texas, Florida, and Los Angeles, after opening their bars, have now closed their bars because they've seen spikes. Miami and Fort Lauderdale, that opened their beaches, are now closing their beaches, and the beaches are going to be closed over the 4th of July weekend because of surging cases. Texas and Arizona have closed many of their hospitals to elective surgeries to make way for the surge in coronavirus patients in their hospitals. I've talked to the governors of these states. They're worried about coronavirus patients overrunning their hospital systems. And so they are going back, shutting economies down again, shutting hospitals to non-critical surgeries, closing bars that were once open, closing beaches that were once open, urging their citizens to stay home. I don't want that kind of a setback to be our story. Let's not let that be the Rhode Island story. We want to keep advancing, advance, and we can advance if we follow the rules. But that is a big if we follow the rules. I don't want you to think this is all or nothing, because it isn't. I never again want to do the lockdown of our economy. There's too many people's livelihoods at risk. You know, it's not just coronavirus. Mental health, mental illness is shooting up. Domestic violence through the roof. Unemployment through the roof. Hardship in our communities through the roof. So if you're somebody out there who says, I don't feel like following the rules, I don't feel like wearing my mask, I don't care, I'm gonna go to the beach in a big crowd, I'm gonna go to a bar in a big crowd, then you need to know you are responsible for the possibility of an outbreak, more people getting sick, more people going to the hospital, more people dying, more people losing their jobs, and our state going backwards, as is happening in many of our other states. And you know what? There's no reason it should happen. Because if we're responsible, we can continue to progress and put more people back to work. And those folks deserve to go back to work. And I want to take a second to talk to young people, folks in their 20s. And I'd ask you to please put the slide up on our experience with people in their 20s. Among 20 to 29-year-olds, we have seen serious increases in cases in this past week. Since June 23rd, cases among the 20-year-olds, 20 to 30 years old, are up between 60 and 70%. You guys aren't following the rules. We need you to do better. Now, it's true, if you're a perfectly healthy 22-year-old and you contract the virus, hopefully you won't get too sick. If you have an underlying health condition, if you're obese, if you're diabetic, you could get very sick and wind up in the hospital. But chances are, if you're a young, healthy, active person who's in their 20s, you won't get very sick. But you know what you can do? You know what you will do? You will spread that to an older person in your family who could wind up in the hospital or worse. You will contribute to an outbreak in your community, in your place of work. And many people who are older than you and sicker than you will get sick, will wind up in the hospital, and will die. All because you couldn't follow the rules. So I have a special message to folks in their 20s. We need you to do better. We need you to own your share of responsibility and care about the rest of us. Care about yourselves, your friends, your family, your mom, your dad, your grandmother. and all the folks in Rhode Island who are still out of work because of this horrible virus. As we approach the height of summer, obviously this challenge of managing this age group is going to increase. And also folks are coming to Rhode Island from other places. You know, we in Rhode Island have done a fantastic job. You guys have been fantastic. But now we have folks from out of Rhode Island coming here, so we need to teach them our way of living with coronavirus. It's on us to educate them and hold them accountable to the rules that exist here in the state of Rhode Island. Somebody asked me the other day, Governor, if I come to your state and have dinner, do I have to wear a mask? Absolutely, 100%. You want to come to our state, follow our rules, because we want to keep our economy open and keep our Rhode Islanders safe. So I would just ask young folks, I know it's summer, I want you to have fun, I want you to go to the beach, I want you to go out and have a good time. Please avoid large crowds. Please keep 6 feet apart. If you can't stay 6 feet apart and you're with a crowd, please wear your mask. It will absolutely save lives, and you'd rather contribute to saving lives than an outbreak. By the way, that experience from 20 to 30-year-olds, it's something we're seeing all over the country. I think it also has a lot to do with the fact that other states have had to shut down bars because they just see lots of congregating and partying, which has led to outbreaks. So given everything we've learned about the picture of the virus across the country and in our own state, I am going to allow us to enter phase 3 starting tomorrow on schedule. I feel confident about that. But I'm going to now lay out a few changes to limit large group gatherings, changes to what I foreshadowed a week ago. And by the way, what I'm about to say is consistent with the approach I've taken the whole time. We really want to enable commerce so people can get their jobs back. But we also have to keep a lid on large group gatherings and particularly social gatherings, because we know that's where the disease thrives, and we have to get people back to work. And so many small businesses are on the verge of not surviving. So, you know, this is a balance. These are very difficult decisions I'm making. All weekend, very difficult discussions between our Department of Health leaders and our commerce leaders. This is a tough call. On the one hand, I have businesses that, if they can't do more business in the next month or so, aren't going to survive. On the other hand, we have a virus which is surging in many states, and 2-3 weeks does make a difference. So what I'm about to lay out for you is what I think is a fair balance to keep everybody safe and healthy and enable as much commerce as is safely possible, with recognition that the virus thrives in big crowds. So if you could please put up the slide on phase 3. And again, I want you to note this is a bit different than the phase 3 slide I put up a week ago. Phase 3 will begin tomorrow in the state of Rhode Island. In phase 3, social gatherings can be no larger than 25 people indoors and 50 people outdoors. So remember, that's a social gathering. That's places like a barbecue, a birthday party, any kind of a social gathering, a family event where you all know each other, and so you're likely to mingle with everyone who's at the event. That's different from, say, a restaurant where you're not going to mingle with the other people there. For social gatherings such as weddings, and that weighs on me. I know weddings, no special day in your life, and a lot of them happen in the summer. By the way, it's big business. So for social gatherings such as a wedding, where you have a licensed caterer involved, and therefore the setting kind of resembles a restaurant, we're going to allow you to go a bit larger. In these cases, you can have up to 50 people indoors and 100 people outdoors. Now, I want to say this. I recognize that a week ago, I said the numbers could be higher. So if you already had planned your wedding and you've consulted with us and your wedding was above the 50 or 100, we want you to call us so we can help you figure it out. We'd like to enable you to have your wedding the way you want it, but we have to be really careful about the regulations. So we need to hear from you so we can help you have the wedding that you planned and possibly let you go a bit above the 50 people indoors and 100 outdoors. Call the Department of Business Regulation at 889-5550, and we'll help walk you through it. So if you've already planned your event for July, and these are July events primarily, because it's likely in August, the numbers are all going to go up in terms of social gatherings. So if you have an event in July, that was bigger because of what I said a week ago, give us a call and we'll work it through with you. Call the Department of Business Regulation. For events that are open to the public, so musical performances and festivals just open to the public, you can have up to 125 people indoors and up to 250 people outdoors, assuming you follow the rules. Social distancing, making sure nobody there has symptoms or is sick, mask wearing, etc. And we're asking you, if you are going to plan an event that you know is going to have more than 100 people, get in touch with us ahead of time because we want you to submit a plan. I want to be very clear about this. This is different than what I said a week ago. A week ago, we said you could have outdoor events of an unlimited size. This week, we're saying 250 is the absolute hard cap for outdoors and 125 indoors. Also, you need to know smaller is better, smaller is safer. Commerce, Stephen Pryor is here. He and his team will continue to work with businesses every step of the way, particularly for some of the new businesses that are going to be coming online. In phase 3, where movie theaters, bowling alleys, that's all going to be coming online. Indoor sports activities, those were closed in phase 2. They are going to be allowed to open in phase 3. And so if you need a hand with that, you could consult reopeningri.com or call Commerce. I want to take a minute to talk about 4th of July. And again, this is different from what I said, so I want to take a minute to talk about it. We do not want to see 4th of July events, fireworks, events, etc., that go over 250 people outside. And we want you to submit a plan to us, which shows that you have precautions in place to keep folks 6 feet apart and distribute masks, or make sure everyone has a mask. We have a call later this afternoon with mayors and police chiefs and town municipal leaders. We're going to be working very closely with town leaders. Number 1, making sure that they enforce this rule of 250. And number 2, helping them. If you need us to help you distribute masks, we'll do it. If you need us to help get your hands on masks, we'll help you out. We want people to have a good 4th of July, but we don't want an outbreak. Someone said to me, are you worried about 4th of July? Absolutely worried. Yes, I am worried about 4th of July. I had a call earlier today with Governor Abbott of Texas. Texas is not in a good position right now. In the space of a few weeks, they went from a 4% test positive rate to over 14% test positive. And he said a lot of it came from big gatherings on Memorial Day. They felt that they had a lot of big gatherings on Memorial Day, not a lot of mask wearing. That happened Memorial Day, and then, several weeks later, they really started to see it in the data, and it changed like that. As he said, they went from plateau to a skyrocket. Let's not let that be our story. Let's learn from that. Let's learn from this tough experience of other places, and let's get it right here. So 4th of July is special, absolutely, and it should be. But we have to be smart and safe. So strict limits, and we're going to help you, municipalities, with enforcement. also help you with plans to get creative, and we're also going to supply you with masks and help you distribute the masks. These limits that I've just gone through and that are on the slide in front of you are applying to all venues of assembly, including places of worship. So that's the 125 person cap for indoor places of worship, 250 outdoor. Now, I recognize that in some cases, we have very large churches or a cathedral. You may already have more than 125 people at a particular service. And as long as you're doing that very safely with masks, with social distancing, with hand sanitizer, we're probably going to let you continue to do that, but you need to call us. So again, call DBR 889-5550. Tell us if you're a church or a synagogue or a big mosque, a big facility, you think you can safely go over 125, you've been going over 125, get in touch with us so we can have a sense of your plan and make sure it's safe for you to continue. Now, what I said before, this is all about enabling commerce. I want to encourage additional growth of the economy and getting as many people back to work as possible. So as you see on the slide in front of you, we're not making any changes to previously announced phase 3 standards for businesses and cultural institutions. So if you're a restaurant or small business, everything I said last week still applies, and phase 3 begins tomorrow. All indoor settings operating at a square footage capacity can still increase up to 1 person per 100 square feet, provided everyone maintains 6 feet of distance. And this includes things like retail stores. All indoor settings currently operating at a % capacity cap can increase up to 66% capacity, provided everybody has 6 feet social distance. So that's offices, that's restaurants. And nearly all indoor venues that were closed in phase 2 can still open. So that's movie theaters, bowling alleys, arcades, museums, and the like. Seated venues can open up to 66% capacity, and free-flowing venues can open at 100 square feet per person, provided, again, everyone maintains 6 feet social distance. So again, phase 3 will begin. Everything related to commerce, restaurants, retail, et cetera, is going to be, as I said a week ago. But we are making some changes to limit large group gatherings in light of what we've seen in the rest of the country and what we're seeing among 20-somethings in Rhode Island. And frankly, the fact that in an ideal world, we'd have a little bit more data of an experience from phase 2 before we moved into phase 3. I want to make a special note about bars, which I've already mentioned a few times. As I said, bars have proven to be a hot spot. Today on the call with the White House, we heard from Deborah Birx, we heard from Dr. Fauci, we heard from many other governors. Bars was a hot topic. And it seems clear from the experience in all over the country that unfortunately bars have been a hotspot, a place of contagion for all the reasons that we know, right? That you tend to congregate, lots of young people, not a lot of compliance, not a lot of mask wearing, and so you're seeing the virus spread. So here in Rhode Island, bars are not operating in the way that they used to operate. You couldn't congregate around a bar. Bars and the way it'll be in phase 3 will continue. Bars that are able to provide seated service to groups at stable tables have allowed to be open and will continue to allow to be open. However, we are not allowing people to mingle in close quarters and be served in front of a bar. And that is not going to change in phase 3. So for bars, phase 3 is going to look the same as phase 2. And truthfully, if I decided to relax that, it is almost certain that we'd be doing what every other state is doing, and in 3 weeks from now, going back to where we are. So instead of having that setback and risking an outbreak, I'm going to keep it right where it is for now for a bar, They can operate, they can open, they can sell drinks, but it has to be according to the phase 2 rules. Okay, I want to talk for a minute about domestic travel in phase 3. I've been asked about that last week. And it's relevant. It's relevant now. Mobility is up. Thank God tourism is up. Some folks are coming here, and even business travel is beginning to happen again. So as I said last week, this is something that we really have to look at. And right now, you know, summer is the season for travel in Rhode Island, so we have to look at it. And to be clear, I want people to come here. Like I want folks to come and spend money in our restaurants and enjoy our beaches, and as long as they follow our rules. Having said that, we have to protect, it's a balance. We want to support our hotels and restaurants, but we also don't want an outbreak. So as of tomorrow, we in Rhode Island will have a mandatory 14-day quarantine for anyone coming to Rhode Island from any state with a 5% or greater positivity rate. 5% or greater positivity rate. As an exception to that rule, you will not have to quarantine if you've had a negative coronavirus test and can attest to the fact that you've had a negative coronavirus test in your home state within the past 72 hours. This rule, when it starts tomorrow, will apply to 23 states in America. Having said that, this is going to change. This is going to be a hard thing to enforce. I'll be the first to admit it. The list will be published today. The list of states will be published today on the Department of Health website and will be updated weekly. So the CDC and Johns Hopkins have a terrific table, and we're going to use that data posted on the Department of Health website. So at any point, if you want to know which states are on the list, go to the Department of Health website and you'll see the states on the list. How are we going to enforce this? We're going to enforce it with signage. There'll be signs everywhere. There'll be announcements everywhere. There'll be signage and announcements on the highways, at the airport, at the train station. We're going to be working closely with the tourism industry, hotels, rental properties, B&Bs, asking them to communicate the rule to their visitors. All visitors at these establishments will have to complete a self-attestation, a form understanding that they know these requirements and that they're either going to quarantine or they've tested negative. Now, if you're a Rhode Islander who travels to one of the states on the list, when you come home, you should quarantine for 14 days, or you could sign up for a test by going to portal.ri.gov. And if you test negative, you don't have to quarantine. So if you live in Rhode Island and you travel to Florida, you want to come home, you have to work or whatever, you don't want to quarantine, you can't quarantine, you have to go get a test, and if you test negative, you don't have to quarantine. Having said all of that, I'd encourage you to stay local. If you don't have to travel, stay home. Rhode Island's beautiful in the summer, and we'd love for you to stay here. Some of you are saying, I will say I've been overrun in the past few days, past week, with a lot of people saying, Governor, please don't go to phase 3. It isn't safe. People aren't wearing masks. A lot from retailers saying, I want my businesses to survive, but look at this busy Main Street. No one has a mask on. We're afraid. And then an equal measure of people saying, hurry up, let's get on with it. So my promise to you is to be extremely fact-based, not emotional, look at the facts as they are on the ground, and be prepared to be flexible. Also, we're in good shape. We've invested massively in our testing and contact tracing, and so we're going to rely on that now. And I'm going to be back up here in the days and weeks ahead with new ideas around enforcement and testing. How do we better use, we have massive capacity to test. How do we best use that to screen folks who come here for vacation? How do we increase our enforcement smartly to encourage compliance? So what I'm saying to you is, I do feel it is safe to enter phase 3. I'm confident of it. And also, we're going to continue to change our response in the days and weeks ahead because the virus is changing and the experience is changing. And that's what we're going to have to do. Constantly change and adapt, just as we have. Having said that, a few months ago, we laid out 4 data points that we watch closely, metrics, hurdles that we have to clear before we move from one phase to the next. It was exactly 4 weeks ago that we moved into phase 2. And I'd like please to put up on the screen these 4 metrics, because I want to take you through exactly how we made this decision and why I feel so comfortable moving into phase 3. So you see in the slide in front of you, we have 4 triggers. We have to get a check mark in each category before we move into another phase. Number 1, we said we had to see less than 70% of hospital beds filled with COVID patients. Today, as of now, we have less than half of that. We're below 20%. And really importantly and excellently, our hospitalizations have been on a steady decline for a month. So that should give you confidence we're ready for phase 3. Second, we said we needed to see consistently 30 or fewer new hospitalizations each day, and we've been consistently below 15 each day. Third, we said we needed to see our rate of spread, which is sometimes called the R0, the RT, infection rate, R value. We said it had to be 1.1 or lower. As a reminder, 2 months ago, the R in Rhode Island was 4. That meant each person was infecting 4 others. Today, it's around 0.6, less than 1. And in fact, the R, we checked it all weekend, and the R values continue to decline since we started reopening. Finally, we said we wanted to see hospitalizations doubling no quicker than every month. And as I said, hospitalizations have continued to decline, so obviously we're not seeing a doubling at all. So we've 4 check marks, clean bill of health, safe to move to phase 3. I do want to say this. We developed those 4 indicators at a time when our testing capacity wasn't nearly what it is now. And those are all mostly lagging indicators. There are also certain indicators. If someone's in a hospital bed, you know they're in the hospital bed. But hospitalization obviously is a lagging indicator. A leading indicator would be how many people are getting tested positive. And when we come up with these criteria, we weren't testing enough people to feel that we could reliably use the number of cases as a good indicator. We may change that now that our testing is so prevalent. So I may be back in a week or so to say that we're going to add a 5th trigger on these slides that we're going to continuously track as it relates to the number of cases, because that's an early warning sign that we might be getting into trouble. Obviously, we don't want to wait until our hospitalizations are doubling, because that means we're already in trouble. So I wanted to flag that today. Okay. I would say the other thing I'm going to be back out with this week, next week, is more guidance on how we're going to be approaching enforcement, compliance, and public awareness campaigns. It is crystal clear now. We know a lot more now than we did 2-3 months ago. It is crystal clear now that social distancing and mask wearing really works. I believe the doctor is going to talk about this, but I think we can say confidently that we saw no surge or increase on account of the large outdoor protests, compliance of a few weeks ago. And we believe that's mainly because there was very high compliance with mask wearing And the Department of Health volunteers and state employees ourselves passed out thousands of masks. We need to make sure, it's clear now, the virus is here, it hasn't abated, it is still deadly, and if you don't follow the rules, we will get into trouble. But if you do follow the rules, practice social distancing, a lot of testing, mask wearing, and staying home if you're sick, then we are going to continue to be able to go forward, open the economy, send the kids back to school in the fall, and move forward. But if we don't, if now in July and in August, we throw caution to the wind, get together in big, large group gatherings, close together, no mask wearing, go to work when we don't feel well, then I don't know if we can open school in the fall. I don't know if everyone can start to go back to work. In fact, we probably won't. So I would simply say to you, I'm calling on everyone's sense of individual responsibility. Do the right thing. Wearing a mask says, I care about you. Washing your hands constantly says, I care about the people in my life and that I work with. I've talked to many employers who've had, mini outbreaks or a few people, and they can all be traced to one person who went to work sick, fever and the sniffles. Not going to work when you're sick says, I care about my business. So it's individual responsibility and shared responsibility. If we do it, we're going to get through this and we will not have a setback. And if we don't, we will have a setback. Okay, I want to take one last announcement. Later today and throughout this week, I'm going to be signing a number of executive orders that are currently set to expire on the 4th of July. And I won't be having a press conference on the 4th of July, and I hope you're enjoying your holiday weekend. So I wanted to just let everyone know now what I plan to do on the 4th of July to extend the executive orders. So I will be extending the following executive orders until August 3rd. So these are EOs that expired July 3rd or 4th. I'm extending them to August 3rd. Number one, face coverings. As I've already said, when you leave your house, take your mask. If you can't social distance, if you can't be 6 feet away, and if you're going to be with someone for more than 10 minutes, closer than 6 feet, you have to wear a mask. Even if you're outside. Even if you're outside. If you're at line, at a pavilion, to get your food at the beach, you should have your mask on. So we are extending the executive order requiring that face cloth coverings until August 3rd. Telemedicine, health insurers must continue to cover telemedicine for all kinds of care, primary care, specialty care, mental health care, and behavioral care conducted by video conference or over the telephone, and reimbursement rates have to be the same by insurance companies as they would be for that procedure if it were done in an office. Anecdotally, I will tell you, we've heard a lot of positive feedback from doctors, nurses, therapists, and patients that telemedicine is really working. And I hope to work with the legislature to make this permanent because it's clearly working. The disaster declaration that ensures we have access to all of the necessary federal resources to support our response to this pandemic, and that gives me the tools that I've needed and continue to need to operate in this pandemic. I am going to extend until August 3rd. The firearm executive order, I am also extending until August 3rd, in keeping with the request from the Rhode Island Police Chiefs Association. As you know, we've extended the time period that law enforcement has to complete a background for a gun permit from 7 days to 30 days. That's just in an effort to give them the time they need to do their job, to do the background check. And then finally, quarantining as we reopen more of the economy and start seeing more people every day. It's obviously more important than ever that we follow the rules designed to keep everyone safe. One of those been diagnosed with coronavirus, you need to quarantine for 14 days. And if you have been diagnosed yourself with COVID, you need to isolate until you no longer have symptoms. And those, as I say, I'll do those later this week, but I wanted to let you know now that I'll be doing that. So it's a lot. I hope it was helpful. I'm going to turn it over to Dr. Alexander Scott, and then we'll answer questions.
Thank you, Governor. Good afternoon, everyone. As always, thank you for being with us this afternoon for the very important updates that have been shared. I'll start with the numbers for today and from the weekend. In terms of the numbers for today, we have 16 new cases to report. Our total number of positive cases rose by 107 since our last update on Friday, because in addition to these 16 new cases, our new cases for Saturday and Sunday were 60 and 31, respectively. There are 73 people currently hospitalized across the state. 15 people are in the intensive care units across the state, and 14 of those 15 in the ICUs are on a ventilator. We have 6 new COVID-19 associated fatalities to report today. This is in addition to the 6 that were confirmed for Saturday and the 7 that were confirmed for Sunday. In total, 3 people were in their 70s, 9 people were in their 80s, 6 people were in their 90s, and 1 person was older than 100 years old. Our deepest sympathies and prayers continue to be with the families of these Rhode Islanders who we have lost. On a more positive note, I did want to provide an update on the patient who I spoke about on Friday, who had been diagnosed with multi-system inflammatory syndrome in children. That patient was discharged from the hospital yesterday in good condition. We're grateful for that piece of good news. Next, I want to talk briefly about 2 additional issues: masks and quarantining. Wearing a mask or a cloth face covering, as the governor has shared, is enormously important. As we learn more and more about COVID-19, it is becoming clearer and clearer that a simple face covering prevents transmission of the virus, and for that reason, it saves lives. The governor already shared the essential experiment that we learned from when a number of large gatherings related to the protests had occurred in early June, many of them attended by thousands of people. To be clear, that was a risk and one that we do not recommend. The good news, however, is that the majority of the people at these events were wearing masks. And that's with huge thanks to the people who already came wearing the masks, as well as those who joined with us from the Department of Health to be there to hand out thousands of masks. That approach was effective. The result of this has been that we haven't seen any spikes in cases connected to those events. Our positivity rate for people being tested after attending a large gathering has been lower than 1%. This is important news. However, I do want to add that masks and facial coverings are only effective if they are worn properly. A mask that is down around your chin and not covering your nose or your mouth is absolutely still not protecting the people around you. You need to be able to cover both your nose and your mouth completely. If you're headed out, bring your mask. If you're going to be around other people, wear your mask and make sure that it covers your nose and mouth fully. We have worked with Rhode Island Emergency Management Agency and our Rhode Island Health Equity Zones to get hundreds and thousands of masks into the communities in Rhode Island that are hardest hit. We are continuing to be aggressive in advancing that. We have made requests for millions of masks. couple of million to be able to cover the entire population. We have received that, and we are now going to work with partners throughout the state, from communities across the state, to help ensure that everyone has some form of face cloth covering in hand. We really want to focus on having those coverings in place for everyone, especially people in their 20s and 30s, those who may not feel like it's necessary because they don't have symptoms, or they're not feeling sick, or that they would end up in the hospital. But as we've said, it is critical for everyone to be wearing it. What other states are seeing and what we have the ability to prevent against right now is the 20-something effect. People in their 20s in other states have been going to bars, going to beaches, going to house parties, all without wearing masks and without taking other precautions like distancing, like washing your hands frequently. The consequences that those states have seen are spikes in cases. Many states can also attribute protests where people weren't wearing masks to spikes in cases. We have the evidence that the governor has shared, and we want to continue to reiterate, and now also have the tools to push out to you that we'll be working on through this week to ensure that people have the items that make the difference. When we say follow the rules, they are simple. It's wearing this cloth face covering and keeping the distance. We have seen some of the increases in Rhode Island based on the data that was shared among our 20-something-year-olds. Earlier in previous weeks, those in their 20s made up 10 or 11% of cases. More recently, those in their 20s are making up 20% of cases. We need young adults to join with us in acting responsibly and taking the measures to prevent the spread of disease. Wearing your face cloth covering or mask, not sharing food and drinks, washing your hands regularly, and maintaining the 6 feet distancing. The entire state of Rhode Island has been making sacrifices, and most young people have been making sacrifices too. I want to acknowledge that and celebrate that. And what we want now is for everyone to join in supporting the small groups of young people who still have some room for improvements, to step up and to make adjustments. These simple changes will make a difference. I also want to talk for a quick moment about quarantining. If someone returns back to Rhode Island from traveling, they still need to monitor for symptoms and quarantine. The key is continuing to see how you are doing. As the governor has shared, we have an exception now that will make it so that you can sign up for an asymptomatic test by going to portal.ri.gov. But for most people, that effort of quarantining, staying local, staying near home, monitoring for symptoms is going to be the best way to prevent the spread of illness and to keep the people in your community safe. So we want people to have options, and we want you to remain informed about what will work best. With that, we will get started with questions.
Governor, on the travel restrictions, a couple of questions, and sorry if I missed this. For people who are driving in, either from another state or returning to Rhode Island, I guess if you're coming from another state, who would ask to see the proof? And then if you're coming back to Rhode Island and take a test, who would then days later ask to see the proof that you've tested negative?
Good question. So as I think I said, this is a tough one to enforce, and I'll be the first to admit that it's going to be imperfect. So if you're renting a property, we're going to ask the rental agency to help us enforce this. If you traveled for work, we're going to ask your employer to help us enforce this, and we're going to be doing a lot of outreach now. But then some amount of people, it's going to be the honor system. So we're going to do a lot on awareness, highway signage and the like, but we're not going to be doing stopping cars with out-of-state plates, stopping folks at rest stops. We're just going to do our best on enforcement.
And if I could just follow up on that, would you allow people coming from other states to get tested here when they come
Yes.
here?
Yes.
So they could do that as well?
Yes, yes. And in fact, yes. We don't want to punish anyone. We just want to make sure that everyone's negative. So if we know for sure they're negative, then they don't have to be quarantined. And so the short answer is yes, but we're also trying to make, I'd like to get us to a place where this is actually a reason people want to visit Rhode Island. So maybe we could do testing in an airport. Maybe we could provide easy, rapid testing for people. We're working on that right now.
Would you want kids to get tested who are visiting as well? So if people are traveling with young children, would you want kids? And just one more thing, I've been asked also about international travel from places that are not seeing high cases. Would that be back on the table at some point?
The answer to kids is yes, and international travel is not yet on the table.
While we're talking about testing, Governor, you mentioned you're going to add a fifth metric on test numbers. What number threshold? And if you don't know yet, what are you thinking?
Yeah, I'm going to let the doctor answer that. I'll tell you now, we don't know yet. But the reason I didn't come out with it today is because we haven't quite settled on it. So we're still talking about it.
Yeah, and to add to the previous question as well about testing, we still want to encourage staying local, monitoring yourself for symptoms. The test option is an exception that's in place, but we still want people, Rhode Islanders and visitors, to understand the value of monitoring for symptoms and being able to stay local. In terms of the type of lead measure that we would be looking for, we are assessing that. We're going to actually do a more thorough analysis of the other states across the country who have seen problems and make sure that we have a clear understanding of what early warning signs from a data standpoint they saw that will help us inform the best lead measure pertaining cases that we can use. Because we are doing such a good job now with testing, we can rely on that confidently. And I'm sure we'll also take into account where we are seeing spikes and clusters as a way to help us guide. Is it just those who are 20 to 29 and seeing what the cases are there in terms of their disproportionate increase? Or do we want to keep an array of early warning signals to help guide us in terms of cases?
Testing, Governor. I remember you set a very ambitious, you want to be doing like 10,000 tests a day, you said in July earlier. I don't think we're getting close. I think we're 4,000 on big days. I haven't looked at today's data on that yet. Would you still like to see that, or has your sort of goalpost for testing changed on what you want to see?
Yeah, awesome question. So our capacity now is just over 5,000. So we have more capacity than we are testing, which is why I'm up here every other day saying, please go get tested, please go get tested. I would love it if another 1,000 people every day got tested. And again, that's also, I think it's a competitive advantage that Rhode Island has. So I want to figure out how to best use it. We're not going to, we are not going to get to 10,000 a day in July. So maybe that was too aggressive, but we are gearing up for a big jump for get back to school. So it's not out of the question at all that in like late August, we'd be 10 to 15,000 because what we're working on now vigorously is figuring out what's a testing protocol to get everybody back to school, which is colleges as well as K through 12. So there's, so I'd say more to say on that, but we're still going to ramp. We're still ramping.
Governor, there's 23 states right now that if they come into Rhode Island, they need to quarantine for 14 days. How do we compare to Massachusetts? I'm just thinking of someone in Florida. You want to get out of Florida. I'm going to go to Newport or I'm going to go to Cape Cod. How do we match up with Mass?
Well, they should come here because we have better beaches and better food. I mean, I think we're doing better than Massachusetts. Is that?
I mean, if you go to Mass, do you have to quarantine for 14 days?
Oh, sorry. That I don't know. Let me say this. I talked to Governor Baker a week ago. He's considering doing this. And I know, obviously, New York, New Jersey, and Connecticut have done this. I don't believe he's yet made an announcement, but I don't know.
And a fear is within these 23 states, for instance, if you're in Florida or Texas, you want to get out of there, and Rhode Island seems a pretty desirable place right now.
I know. And that's a problem if you're positive. So if you want to come here, fine. Get that, make sure you're negative before you come. Or if you can't do that for your first 14 days, quarantine. As she just said, stay close to home, stay with the people you came with, stay here. Listen, it's fine. We want to be a refuge because we're a safe place, but we can't, we know how, like the data is so clear on this that outbreaks all around the world often start from one person traveling to someplace. You saw that there was something, I think it was in the New York Times about a month ago. It showed how all the people that left New York City when it was a hotspot and traveled and started mini hotspots. So listen, come here, but either get yourself tested to be negative or quarantine.
Do we have effective testing in Newport? I mean, you have those new hotels. That's a place that would certainly attract people from the outside.
The answer is yes, but I want to do more. That's exactly where I want to go next. And I think it could be a selling point for Rhode Island. Come here and safely vacation. Come here, get yourself tested, and know that this is a place with a 4% test positive place. Not Texas, which is 14%. So that's where we want to get.
Governor, we have 23 states now who meet that criteria, the 5%. Are you going to be posting the rates of other states so that folks here know if they travel there, they're in a place where they're quarantined, or vice versa? How is that going to happen? How is that information?
So as I said, Johns Hopkins is doing a great job of keeping this up to date. You could go on their website, but we're going to put it on our website. It's constantly evolving, and we're going to update that once a week on the Department of Health. So at any given time, if you want to know what's going on in every other state in America and which are the states that are above 5%, go to the Department of Health website, and there's a list.
And before last week, you were considering doing a county by county one. Why did you decide? Was that impractical? Or?
So a week ago, we were, I thought what you were going to ask me was I was considering 10% as the threshold, and we decided to go 5% out of an abundance of caution. And we decided to, honestly, to do the state because it's the most easily available data, right? Like some of this is just enforcement. So this is a nice chart. We can put it up every week. It's easy for people to follow.
And then one other thing on that, last week when we first saw the real surge in other places of the country, you admitted we weren't quite certain exactly what we were seeing and why across the country. Are you confident now that it is the bars, it is partying that has caused it, or is there still uncertainty as we move to phase 3? What's happening in a state like California that does actually have pretty strict rules around COVID?
Confident is a strong word. So we've spent a lot of time looking at other people's data. I've been talking to governors. Stefan's been talking to his commerce colleagues. Dr. Alexander Scott's been talking to her. We're talking to everyone we can. What is really going on in your state? Although there's no certainty, if you talk to the folks in Arizona, they'll tell you that they did have large-scale protests, very low mask wearing, and 3 weeks later, spikes. Same thing in Texas with Memorial Day. County by county, you are seeing issues with bars. So I don't think any of this is I think, listen, I don't believe in like the false sense of precision, but they do have, as we have, contact tracing systems set up. And they have a pretty good handle on how many people are sick now and what instance were they related to. And they believe that they could do enough of their contact tracing to say a preponderance of these new cases came from these, episodes. It doesn't mean that's the only factor, which is why I'm hedging a little, but they feel pretty confident from their contact tracing that that's what it came from. And we see it too. We see it. I didn't give the data for the weekend because I had too much else to go through, but we see it in our own inspections over the weekend. And you can see it. Brian asked me a few weeks ago, you can see young people get belligerent when you ask them, oh, could you please put your mask on? Could you please separate in a crowd?
Do we have data on inspections of restaurants or bars or shops or wherever it is you're that?
We do. I'll go over that on Wednesday. I should have done it today, but we did our usual hundreds of inspections, and I'll do that properly on Wednesday.
Director Alexander Scott, we've gotten a few reports from Newport and Providence restaurants that they've had workers who have tested positive. Number one, is that something you can confirm? And number two, what's the protocol for a restaurant or any other facility, public facility that has a staff member test positive? Do they have to close? How does that work?
With each situation, we handle it individually, depending on the exposure risk, whether or not someone who had symptoms was actually working. And we have a very extensive involvement with the organization. That type of response happens on a regular basis. So I'm not able to speak specifically to what you're saying in those particular communities, but they are the types of conversations that we are engaging in. From a public health perspective, we often work with the business to be as thorough and as comprehensive as possible while supporting them in maintaining the business that's in place. Safety is first, and then being able to say, how can we do this so that you can continue? The same happens in a school setting. How can we wrap our hands around the people who may have been exposed, make sure that they are able to be quarantined, that they know that they need to monitor, and continue to keep the education going, people coming into school, that type of example. So each situation is handled individually. If it's a smaller place, there may have been more people exposed. There may be more of a need to close down. If it's a larger place, for example, there may be a different response that allows us to be more flexible.
Has the Department of Health shut down any restaurants in Rhode Island for COVID outbreaks among staff members or even patrons?
As of what I know right now, we have not specific to an outbreak of cases.
And what about asymptomatic testing for restaurant workers? Are there any results for that? It's been a couple of weeks since that began.
Yeah, I shared the high level percentage positivity from our asymptomatic testing. It continues to be in the single digit numbers. I can come back and provide more detail about the different job sectors that we have been testing. It is definitely proving to be a very valuable resource for us to get a sense overall from the different sectors, what type of percent positivity exists, and then to be able to reassure those businesses as well that we're seeing single digit positivity rates. So I'll bring that back, but want to use your question as a way to encourage those high contact workers that we have made this testing available for to go ahead and get tested. Go to the self-scheduling portal.ri.gov and get tested, and it can be done more than once. We welcome cyclical testing once a week, once every 2 weeks if you've already done it and want to get it done again.
The bottom line is if there's a restaurant open in Rhode Island, patrons should feel comfortable going there.
Absolutely.
Hi, James Bissett, Providence Business News. This question's for Governor Raimondo. Governor, how would you describe the state's enforcement policy on various reopening regulations for businesses? Because it appears to be a soft enforcement with really random checks by state officials on certain businesses, with results being kept between businesses and DBR. So without public transparency on that process, are you concerned that businesses either have reopened or are about to reopen that have been patient and been following guidelines will begin to really apply their own interpretation as to how the rules should apply to them and wait for a random DBR visit?
Mm-hmm. So it's an excellent question. And I previewed in my comments today that either Wednesday or next week, I'm going to have a lot more to say about enforcement. We have had a very light touch around enforcement, exactly as you said. As I've said so many times, we're not heavy-handed. We want to give you a hand. I think it's time that we start to change that approach now that people know what they need to do and they've had a couple of months to get up and running. And truthfully, my opinion is mostly influenced by hearing from so many restaurant owners and retail operators and gym operators who are following the rules. They're saying, hey, Gov, increase the enforcement because we don't all want to be shut down for a few bad actors. So we are right now, today, tomorrow, over the weekend, working on how exactly do we change our enforcement in order to increase compliance. So right now, we're doing what you say. We have the rules, they're crystal clear, they're online. We're doing lots of random unannounced inspections. If you don't comply, we're asking you to comply. In some instances, we have fined people, but it is, I believe, time to do even more, and we're trying to figure out exactly how to do that.
What would you say is like an approximate percentage of the quote unquote bad actors, if you will, that have received fines or anything like that to this point?
Yeah, thanks to the tremendous work of our enforcement team thus far, there have been about 10+% or so of really bad actors that we are doubling down in focusing on. There's a third or so that are doing really, really well. And then another group in between that are in between that we want to continue to work with.
Dr. Alexander Scott, this question is for you, because I know before, like in typical instances, like say, for example, restaurants, you know, the DOH puts out, is pretty transparent as to showing who the violators were with restaurants for basic work conditions of that sort. For this particular case regarding COVID regulations, is there going to be maybe a similar transparency portal set up to show which businesses were in violation of specific regulations going forward, to really highlight, hey, if businesses do this, this is what they were violated with, and this is what can happen to you if you fall under these violations?
Yeah, that excellent question is exactly the type of assessment that the governor just shared that we'll be coming back with, the next level approach to enforcement so that we can really expand the outreach piece and help the public be more a part of the process of helping everyone follow the rules.
Okay, so there's going to be more guidelines issued about that on Wednesday.
Either Wednesday or next week. But we are working on that.
I'll tell you where I'm coming from, because this is a judgment call. I didn't think it was fair to be heavy-handed out of the gate. This is really hard. Everyone's struggling. It takes a certain amount of creativity to figure out how to comply. And so the approach that we took is everything's on reopening RI, everything's really clear. We're trying to, every business that calls us gets a call back. Like, we're trying to be a helpful hand for people in the first instance. And also I'm trying to highlight the good actors. So one day last week, I just talked about 4 or 5 businesses that were doing an awesome job. Now that now we're entering phase 3, people have had a couple of months to figure this out. Now I think it's time to turn up the heat a little bit on people who are not complying and doing exactly what you said. Like, a consumer should be able to know, is this a restaurant or a company that's following the rules or not? So I decided to wait a little bit, but now that is exactly where we're going to go.
Is there going to be more of like what's been kind of going on right now, where it's just like random spot checks, or is there going to be?
We're always going to do that.
Is there also going to be like an add-on if they receive like certain complaints either by a business owner or maybe customers or anything like that?
Yeah, we're also going to really expand the number of people we have doing the spot checks. Do you want to say something?
DBR on its website has an opportunity to submit a comment, or the phone number that the governor mentioned is also available. DBR does receive complaints or tips, if you will, and they can even be anonymous on an establishment. And then generally speaking, there will be inspections that follow if it's warranted, or it could be a phone call. It depends upon the specific case. So I think that's responsive to your question.
Okay. Secretary Pryor, today is the first time we've heard anything to the effect that there have been actual fines imposed. Can you give us some insight on what that process was, how many businesses were fined, whether they were warned, second warned, or how that process sort of occurred, and then is there an appeal process, or what happens?
This approach may change given the governor's guidance. You've heard her articulate the general approach that we're taking as we enter phase 3, but so far, most businesses have received more than one warning, meaning that there was an inspection visit, a second inspection visit, or a phone call with the establishment's owner. Commonly, there were even 3 instances of interaction. There's something called a compliance order that is put in place where a business knows that it must comply or there can be consequences, and those consequences can include fines, and they can also include some form of closure if necessary. We hope not to exercise that authority, but it can.
Can you indicate how many businesses made it to the stage of 2 warnings and some sort of further action?
I think we can do that. It would need to be something we follow up upon after this press conference. It's a handful of businesses at this point in time that have received compliance orders.
Was that because, as far as you know anyway, was that because they were willfully non-compliant or because they simply didn't know how to comply or didn't have
I could not offer you insight there. Yeah, no problem.
Yeah, Pat Ford, Coalition Radio. Secretary Pryor, I'd like to talk briefly about Tidewater Landing. Fortuitous Partners effectively missed their April and May deadlines. They've now been extended until September. When you analyze the pillars that the development is based on, for example, hotels, according to a June 10 report by McKinsey, in one analysis, hotel revenues may not return to almost its normal status until 2023. Sports stadium construction. While most stadium construction has continued, in-person attendance, the driver for ancillary income, has clearly collapsed. And finally, retail construction, prior to COVID, according to a Moody's report, had sunk to a 2-decade low in the first quarter of 2020. What is the likelihood Fortuitous Partners will receive financing? And critically, in the event of a tax shortfall based on revenues within the TIF district, who will pay the shortfall?
There's a bunch of questions embedded in there, all of them good, by the way, so I'll do my best. I welcome the question about Fortuitous and the Pawtucket project. We've been enormously impressed with the ability of the Fortuitous team to progress all the way through the crisis with their due diligence and fulfilling the municipal hurdles necessary to carry out their economic development project. It's been quite amazing to see that very talented team progress, and quite frankly, working with the governor, Mayor Grebian, continuing with his persistent and effective approach with pursuing this project. So that's what it takes to get a project done. You're right, there are a lot of variables in the world right now as pertains to in-person sports and entertainment and hotel stays. Keep in mind that the project was designed to be nimble in that it includes a residential component, an office component. There's a pedestrian bridge, there are outdoor elements. This is a very creative team that is following closely global events and trends, and we're encouraged that they have the ability to adapt and to, as a result, modify their project. We don't know precisely what the final outcome will be, but I will say that I would not count this one out.
But excuse me, with regard to tax shortfall based on revenues within the TIF district.
The way the deal framework has been articulated to date, the tax is structured as a TIF or a super TIF, tax increment financing. That is to say the tax flow from the project would be captured and pledged back to the project and utilized by the project. So there's, under the current framework, there is no direct subsidy or other mechanism. That's the framework that we continue to pursue. Yes, ma'am.